Go.
Okay, so what we're doing today is we're doing some balance exercises, some cardio exercises, and some strengthening exercises to help with COPD patients. COPD means chronic obstructive pulmonary disorder, and what correlates with that would be bronchitis or emphysema. And with these exercises, it's supposed to increase pulmonary action, so for people to breathe and stuff. So the first one that they would do would be recumbent biking, which means they're going to be on a bicycle where you can move your feet and move the arms at the same time in a reciprocal motion. And they're going to do this at least 3 to 4 times a week for 20 minutes. And they're also going to be on a walking program. And this walking program is going to be 5 to 7 days a week. And all that means is they're going to do the regular pace walking for 20 minutes a day, at least once a day, including the recumbent biking. Another thing they can do to kind of mix it up a little bit, that they could do 3 days a week, would be upper extremity biking. And using the upper extremities is actually going to work the cardio muscles more than it would doing the recumbent biking. And they could do that 2 to 3 times a week for 20 minutes. And as far as strengthening, what they would do to increase the strength of the diaphragm is important for allowing the lungs to expand within the thoracic cavity. So what they're going to do is they're going to lay supine like this, and their hands are going to be on their stomach so that they can feel their stomach inflate as their lungs expand. And what they're going to do is they're going to breathe in through their nose and hold for 5 to 10 seconds, and then exhale through their mouth. Now when they inhale, they're going to hold their breath, and instead of allowing their chest to rise or inflate, what they're going to do is they're going to use their diaphragm, so their stomach's going to go up. So it will look something like this. And they would just hold that. Another one to increase lower extremity strength is they would be sitting in a chair, most likely with arms. So what they're going to do is to increase leg strength, they're going to push off the chair, or if they can't push off, or they don't have to push off the chair, what they're going to do is they're just going to stand up and then sit back down. And they're going to do a set of 10, and they're going to do 3 sets of 10 for that. Another thing that they could do also is marching. So they'd be marching in place by raising one leg and then the other. And they could do a set of 20 of these and do 3 sets. So for balance, a lot of COPD patients have loss of balance due to their breathing issues. So what they can do is they're going to stand laterally to a stool or step up. They're going to have one foot on, and they're just going to step and rise up on one foot, and then back down. And they're going to do this 10 times for 3 sets. And then the next balance exercise I had was a step up, and that's where they're going to stand behind the stool or step, and they're going to step up with both feet like this, and then back down with the opposite foot. So it would be up with the right, up with the left, down with the right, down with the left. Or you can change it up and go up with the right, up with left, and then down with left and down with the right. This would help with neuromuscular issues too, giving them step-by-step instructions, because it would make them think about which foot they're moving in front and behind. Now, as far as preventing falls, for if they were rocking back, what they would do is they would do a heel-toe rock-up, and that just means they're going to go to heels, and then toes. And that would help them be more aware of their balance. And if they lose their balance, they're just going to do a step back. And a step back means, like, if I lost my balance doing this, then I would just step back. And as far as exercises, that's all I've got for you.